I'm going to wager with you that if you walk down the street and ask somebody, how does late-term abortion actually happen, they would have no idea. Now, this is a deliberate cover-up by the abortion industry. I'm going to reveal today a document that explains the late-term abortion operating procedure for an Australian hospital that has since been scrubbed from the internet, but I've got my hands on a copy, and that's today on the Dr. Jo Show. So before we get into the show, can I please ask you to hit the subscribe button if you are new to this channel? So today we're going to talk about late-term abortion, and I know it's a very grim topic to discuss, especially how this actually goes down in reality. But I want to explain it because it is such a pivotal piece of the puzzle to understanding late-term abortion. There's so many lies around abortion, around late-term abortion that we've been talking about on this channel. The fact that people say, oh, it's rare, it only kills babies who are going to die anyway. I want to dive in today to the method because there's lots and lots of lies around this. And this came to the fore last year when a group of us introduced the Live Births Bill in South Australia. And this bill said that instead of killing your baby after 28 weeks and up until birth, you could terminate your pregnancy. So the mother could remove that child from her body, but instead of killing the baby first, the child would be removed alive. So instead of delivering the baby stillborn, which is the process for a late-term abortion, she would deliver that baby alive. Now, the big lie that we fought against in that bill was this idea that this was a forced birth bill. Let's take a look at what Channel 7 said, which typifies the misinformation around this.
There are several different groups gathered here today who are against the private members bill. If passed, it would force women who want to terminate after 27 weeks to instead be induced, give birth, and then hand their babies over for adoption.
So you'll note the language of the journalist. The mother will be forced to give birth. She didn't say the mother is forced to give birth anyway, that a late-term abortion is a forced birth. But she made it sound that the innovation of the bill was that it would force women to give birth against their will. And that sounds very Handmaid's Tale, doesn't it? Very dystopian that you've got, these men in kind of like white jackets and, clipboards standing over a woman and forcing her to deliver this child, when in actual fact, a late-term abortion involves that. Now, this lie was repeated time and time again in the media. Now, you'd expect that lie being repeated from The Guardian because they have a pro-abortion editorial position. So, this article, this headline which said, bill proposing South Australians seeking later abortions give birth tantamount to forced birth, Greens say. And then this opinion piece by Van Badham, which says, Liberal Ben Hood's forced births proposal demands outcomes both cruel and ridiculous. So you can see there in a pro-abortion media, an explicitly pro-abortion media, that they're perpetuating this lie around forced birth. But in The Advertiser, which doesn't claim to have an editorial position, if they do, they're not explicit about it, like The Guardian. And yet right from the beginning when this bill was being introduced, they went out with these breaking news alerts describing it in a way that was deliberately misleading. So this Advertiser headline said, laws banning late-term pregnancy terminations to be put to SA Parliament. And it was accompanied by a survey which said, do you support a law banning late-term pregnancy terminations? So again, what someone watching that or reading that would think is that you can't terminate your pregnancy because of this new bill, when in actual fact the bill allowed you to terminate your pregnancy, it just didn't allow you to kill your baby. So anybody filling out that survey is filling out a dud survey because it's not actually an accurate representation of what the bill does. But, the Advertiser went out with this. And again, in other headlines, they said Liberal frontbencher Ben Hood's abortion bill on brink of upper house support. But look how it's described. A Conservative Liberal frontbenchers bid to force mothers terminating pregnancies to deliver babies alive. So to force mothers deliver babies alive. And it's misleading if you don't say that they already have to deliver those babies anyway. Now, when this started to happen, my response was, I knew I couldn't do anything about The Guardian, but my response was, I'm going to message these journalists from The Advertiser who I did have the numbers of. And so Paul Starrick, who's one of the editors, I immediately messaged him and just said, this is complete misinformation. You are deliberately lying about this bill. Now, I wasn't 100% sure whether Paul and some of these Advertiser journalists were deliberately lying or whether they just didn't know, whether they were just ignorant about what's really going on. It's pretty certain that when the Greens and the abortion industry and The Guardian were misleading people, that was deliberate. But it is theoretically possible that journalists at the Advertiser had no idea. So I would message Paul Sturrock and I said to him, this is the procedure for a late-term abortion. A mother goes into the hospital. She goes under anaesthetic. They inject the baby's heart with poison. She then takes labour-inducing drugs and they deliver that baby dead. And I said, all this bill does is stop the injection into the baby's heart so she can deliver the baby alive. So when you call it forced birth, you're actually misleading people. Now, he got argy-bargy with me back and forth on text message, but I kept going back with that. And I also produced content on social media explaining the lie, and then I would send that to him so that he could see it. And I think that was actually a really effective strategy because we were facing wall-to-wall media blitz of this forced birth lie. It was everywhere. Our only method of getting to people directly was through social media. So we were producing 3 to 5 pieces of content every day. And I would send that directly to the journalists who were lying or who were maybe ignorant and therefore misleading people, just so that they could then know the truth. Another one of those journalists was Catherine Birmingham, also from the Advertiser. And this article that she wrote, Adelaide's Catholic Archdiocese voices support for abortion law reforms that force women to give birth after 28 weeks. Now, Catherine, I ended up messaging and emailing and saying, look, you cannot say it forces them to give birth unless you also explain that they give birth already. And I explained to her what a late-term abortion procedure was. We ended up going out for lunch and Catherine ended up writing about this in a much fairer way as the debate went on. It only went on for about a month, this debate over this bill. But although she started from this position with this kind of forced birth language, I did see a shift in her and I actually saw a shift in the Advertiser. So I felt like some of what we were doing was really working. One of the things I would do was in the middle of this campaign, I realised we really need an animation to explain to people how a late-term abortion happens. And so we produced an animation. And before a journalist wanted to interview me, I would make them watch that animation so that we were at least on the same page about what the procedure for a late-term abortion was. Now, that didn't help with everyone because there were some people that just deliberately wanted to lie about this. So, for example, the Daily Oz, which is an online media organisation, they have a big reach on social media, and there were deliberate lies being told there. Check out this post. Liberal MP Ben Hood has introduced a bill that would require anyone seeking an abortion from 28 weeks to give birth instead. Now, they give birth anyway, but that's not in this Daily Oz post. And so that's an example of a journalist that I just can't even reach because they haven't called for a comment, but they're deliberately putting up lies on social media. And our ability to kind of combat that is only through our own voice. And it wasn't just from the media, it was also from political parties. So you can see here this tweet from SA Labor, which says Donald Trump and the MAGA crowd would be proud of the latest SA Liberal policy proposal that would force women to be induced. Again, a deliberate lie that was then repeated in the media, but forcing women to be induced, well, that's the procedure for a late-term abortion. And so this was what we were up against. I wasn't expecting this because I felt like we'd drafted this historic bill that hadn't been introduced anywhere in the world, that genuinely had found a compromise between the pro-abortion position and the anti-abortion position, because it still allowed a woman to get her body back, to remove that baby from her, but at a gestation where the baby could survive and indeed thrive. At 28 weeks and afterwards, there's a 96% chance of survival, and that baby actually has a really good chance for life. And so, if the mother's really struggling mentally at that point, she can deliver that baby alive and care can be given to her and care can be given to the baby. She might change her mind or the baby could be placed for adoption. So either way, it really felt like an opportunity to create a win-win. But when you're up against the lies from, pro-abortion politicians and the Greens and Labor, and then they're perpetuated through media, that is really, really difficult. But as I said, our strategy was threefold. We had the social media. We also had a truck driving around Adelaide for almost every day of the campaign. And you can see the messaging there, which we explained what a late-term abortion was. So we said, did you know that a late-term abortion requires a woman to give birth, to be induced and give birth? We also, put out that information. Did you know that 45 healthy babies have been killed by abortion up to birth in South Australia? Because again, that was a lie the media kept telling. This is just about really, really sick babies who are going to die anyway. So we had those strategies, and we also had our, online town hall and our in-person town hall. We also had 2 rallies. So there were lots of things we did, but ultimately we did face a pro-abortion media establishment. We faced journalists who knew nothing about the issue, and we faced deliberate lies from the abortion industry. So now what I want to pivot to is to just really go through in some detail what is the operating procedure for a late-term abortion. And as I said at the start, this is actually something that has been scrubbed from the internet. So thankfully, I took a PDF of it when I downloaded it a few months ago. But what I see now is, because I've talked about it a little bit on my social media, you can no longer get this. You can't access it online. But this is the procedure from the Royal Hospital for Women, and it's their clinical policy procedure guideline. So this procedure is called the fetal and multifetal reduction procedure. You can see first up in the aims section, this is about either singleton feticide, so killing one baby, or it's about selective feticide in a multiple pregnancy. So that's when you've got twins or triplets and you only want to deliver one baby alive and the rest you're going to deliver dead. The other is a multifetal reduction to reduce a higher order multiple pregnancy to a singleton. And then it says appropriate and sympathetic supportive medical and psychosocial counselling of the woman. So you notice straight up in the aims, very much oriented around the woman's health, but the baby is completely dehumanized through this procedure that's called feticide. And remember, like if you think about the word side, it means to kill. So like, pesticide, infanticide, homicide, these are all words that describe killing. And here in this procedure in black and white, it's feticide, it's killing the baby in utero. But remember, this is about a late term abortion procedure at a point when babies could survive if they were induced. Indeed, premature babies are born all the time after 22 weeks and 6 days up until birth. This is a regular occurrence. In section 2, it describes the patient. So that's a woman requesting induction of fetal demise prior to termination or requesting a selective feticide. So note really, again, there the dehumanization. The baby is not considered a patient. And so you've got two human beings, but only the woman is defined as the patient under this procedure. They detail the staff that are involved, so maternal, fetal medicine specialists, counsellors, social workers, psychiatrists, sonographers, people doing the scan of the uterus, and then they talk about the equipment that's going to be needed. So an ultrasound machine, which they do because they have to look at the baby first. They have to find the precise location of the baby's heart. There's various needles. There's an anaesthetic pack when that's for the mother so that she's not in pain. And then you've got the gowns and things that the doctors, the staff are wearing. So the medication is section 5. And what you'll see here is sterile KCl concentrate in 10 millilitres. Now that is potassium chloride. So that's the agent the poisonous agent that will kill the baby. But you'll see there's some other medications listed. So morphine if you're going to give the baby pain relief, or this other medication called rocuronium bromide, which is for fetal paralysis. So if you want to stop the baby moving so that you can make sure you get the left ventricle of the heart, because that needle has to be very precise, that is another medication that can be used. Now, probably the guts of this procedure is in clinical practice, section 6. So what does it say? It says you counsel the woman with regards to her options, you ensure she's met a social worker, and that you fulfill the hospital termination review process after 20 weeks. You advise her of the risks and you get written consent. You offer her oral anti-anxiety medication or oral pain relief, and you give that 30 minutes to the procedure. So again, all of that at the start is about the woman as the patient. But what you can see is it's clearly saying you're going to have an abortion after 20 weeks, and this is what you do. You have to talk to a few people, you've got to get the consent, but ultimately this is the very low bar for killing a viable baby late in pregnancy. You perform the procedure in an ultrasound room, typically with a medical assistant or a midwife assistant. And so the next thing is you confirm the site of the relevant fetus or fetuses on ultrasound. So that is essentially saying find the baby. So you've got to see where they are on ultrasound. This is an ultrasound guided abortion. And so let's unpack that for a second. You've got a doctor, someone who is meant to be about restoring health and helping someone recover from disease. They're literally there with their doctor's hat on, watching this baby move, this very much alive baby who can feel pain and knows her mother. And they're watching this baby on an ultrasound with the intention of going directly in to kill that baby. That's how sick the person is who's doing this procedure. The next bullet point, administer local anaesthetic to the woman at the relevant site by an injection. So that's giving the woman pain relief. So you've already given her Panadine Forte and oral anti-anxiety medication, but now you're actually giving her an anaesthetic so that she can't feel the pain when the needle goes into her abdomen and then into the baby's heart to kill the baby. So they focus on the mother's pain, but the baby, let's look at what it says. It says, consider the use of intramuscular morphine to the fetus in gestations of 24 weeks and above. So it's not mandatory. It's just, well, think about it, but let's just think about the psychopath that it would take to kill a baby in this way. Like, this is not something a regular doctor is going to do because it is so psychotic and barbaric. So you've got someone that is horrific enough to actually want to go in and kill that baby with a needle filled with poison. They're not going to give this baby pain relief prior to doing that because they're clearly murderous. They're clearly someone that, at some level thinks it's okay and maybe even enjoys killing this baby, watching this baby go from being very much alive, sucking their thumb, hiccuping, playing with the umbilical cord, to suddenly having a heart attack after you inject them and dying. This is a psychotic act. The next step, enter the amniotic cavity under ultrasound visualization with 20-gram needle. Aim for intracardiac injection. So this is find the baby's heart, watch that heart that's currently beating, and inject that heart with poison. Intercardiac means get it into the heart. Aspirate the fetal blood to confirm correct needle placement. So you have to check you've got it in the right spot, because if you haven't, this could be very dangerous for the woman because you're literally injecting her baby with poison. If you get it in the wrong spot, you could kill the woman. So it says find out you've got it in the right spot, then inject KCL and look at the different amounts. First trimester 1 to 2 mils, second trimester 5 mils, third trimester 10 mil KCL. And so that tells you something, doesn't it? It shows you straight up they do this all the way up until birth. They do it in the third trimester from 28 weeks up until birth. And you need more poison as this baby gets bigger because they're bigger. And so to kill a baby at 28 weeks is going to take a greater injection of KCl, potassium chloride, than it would to like a little baby, in the first trimester. And it just, I think, really exposes what they're doing, doesn't it? That they need more poison because they've got a bigger, more advanced baby. It then says watch for acetol, inject further KCl up to a volume of 10 ml if required, and watch for 2 minutes to confirm. So that word acetol means that the heart has stopped. So watch to see that the baby has indeed died. They've gone through this burning sensation. Their heart has had experienced this cardiac arrest, and then it stops. And so you're meant to watch for that, but it doesn't always work. In fact, in some babies, they survive this process and then they've got to go through that agony all over again. You then have to rescan to make sure, and then look at the last bullet point, arrange admission for induction of labour where appropriate. So you can't just leave a dead baby inside the woman. You actually have to arrange induction, which is you have to give birth. She has to give birth. This document has now been scrubbed from the internet. We lost the live births bill debate last year by 1 vote, but this story isn't over and it relies on us. So I'm going to ask you to share this video, to comment below, and to make sure that you let people know how a late-term abortion actually occurs. And when you see those lies in the media, write a letter to the editor, post a video, tag them, because we have to be the voice for these babies. Thank you so much for watching, and that's today on The Dr. Jo Show.